Let me just start with a little bit of an introduction about Quizify and our health literacy services. Al Lewis, our CEO, is going to be leading our discussion. And Al is recognized as one of the foremost authorities in wellness and population health. He authored a book specifically about wellness outcomes analysis, Why Nobody Believes the Numbers. And another book that was written far back in 2013 with Tom Emmerich, who managed benefits at Walmart for more than a decade. And Al and Tom wrote about things that have gone mainstream, like centers of excellence, better pharmacy benefit management, better medical management. Um, we also have a relationship with doctors at Harvard Medical School who review our medically oriented content. And you'll see their seal actually on that content. A lot of health literacy information is somewhat surprising, new, and this adds credibility to what people are reading about. We've also been mentioned in some mainstream publications. The late Marshall Allen mentioned us in his book about hospital billing. The New York Times mentioned us, and the book on the right there was written by a Dr. Marty Makary, who is the incoming FDA commissioner. And he calls Quizify a wellness disruptor in his book. And here are some of the things that he says about us. He really likes our methodology, the entertaining, engaging way that we interact with employees in different groups to help them become more health literate. He also specifically agrees with us and is an advocate that there is a tremendous need for health literacy education. And this book, The Price We Pay, is about predatory pricing and also about predatory medicine, where aggressive for-profit systems know that patients are only paying a small portion, and these patients don't necessarily understand the risks, ask the right questions, and can be pulled into unnecessary and potentially harmful tests and procedures. So part of what we'll be talking about today is to understanding this a little bit better so that you're prepared. So without further ado, here's Al Lewis to lead our discussion.
Thank you very much, Mark. Yes, this is the 10 greatest hacks in health literacy, and hacks have precedents elsewhere throughout history. As you can see, many hacks have proven both easy and effective. The best hacks make behavior change a feature for employees rather than a bug. Now, hacks, the difference between hacks and wellness is that hacks address employee knowledge deficits instead of employee willpower deficits. So basically, you'll see that essentially all you have to do is know this stuff and your behavior automatically changes. Whereas in wellness, trying to lose weight, stop smoking is 5% knowledge and mostly about your willpower. Now, the thing about hacks, and I'm getting up the whiteboard here like Mrs. Krabappel on The Simpsons. They are easy to teach, as you'll see. They're easy to implement, as we'll show at the end. They're easy to measure. We have a built-in measurement tool. They're quite affordable, but most importantly, they are easy for employees to appreciate, as you will see, starting right now with Big Food. So many of you know this classic Quizify question from our homepage, actually, which is we show a typical granola bar, and we ask how many different kinds of sugar there are because these things are marketed as health foods. The answer is shocking to some people, but there are 10 different sugars mentioned on this label, even though the first ingredient looks healthy, so you think it's healthy. Now, obviously, this is not the only example. We've got quiz after quiz after quiz of examples, but let's throw one open to the group. And actually, this is the perfect time to do that because a couple of questions per Mark's suggestion are already coming in. And how many teaspoons of added sugar are in this 8-pack of 4-ounce juice boxes? And while you're doing that math, Mark, let's make a dent in the questions coming in here.
Sure. The first one is about Dr. Makary. And is this appointment as commissioner of the FDA, is there a political aspect to that?
Well, he's actually considered the least controversial of all the political appointments. And in fact, this Quizify may be the only thing that the Trump administration and Harvard Medical School agree on. So Yeah, no, it's great. We're very happy to see him in there. Mark, what do we get for some answers here? Um, so it looks like people said 30, which is correct. So congratulations on not noticing or realizing that this added sugar thing was a scam. In fact, these things are full of added sugar. Basically, big food is poisoning your employees' kids. I put poison in quotes. Some people don't think sugar for kids is poison. I do. No other vendor addresses this. Note that there are 15 grams of carbs, of which 14 are sugars. It says zero added sugar, but if you look at the ingredients label, every single fruit concentrate on here is classified as an added sugar by the FDA. There is a loophole that every juice box company is driving a truck through, which is that if you take a bunch of water and you add fruit concentrates, sugar to it in the form of fruit concentrates, that's called a natural sugar, not an artificial sugar. Your body doesn't know the difference. So let's do one for adults. Approximately what percentage of people should cut back on their cholesterol intake? And your options are 0, 20, 40, and 60. And Mark,
Well,
I'm
here's
looking
one
at
from the
this.
group, Al,
Yeah.
regarding the juice boxes. Isn't that false advertising?
No, it's perfectly allowed. That's the thing. That's why you need Quizify. It is perfectly legal to say there is no added sugar if you are sweetening this with fruit concentrate. Now, if you're sweetening a granola bar with fruit concentrate, you have to call it an added sugar. This is a loophole.
Yeah.
Maybe our friend Marty will close it. To be honest,
Uh,
I kind of hope he doesn't, because if he doesn't close the loophole, Quizify still gets to talk about it.
It's not considered added because it does, in a sense, originally come from the fruit, except that, humans or animals wouldn't consume fruit in a processed, concentrated form in nature. I mean, they're playing with words a bit here.
Yeah, they are. And when they create the sugar out of it, they're getting rid of all the fiber and everything. Typically, when you eat a piece of fruit, the sugar is buffered by the fiber and the other components of the fruit. It's not buffered. You just your body is not designed to throw sugar water down your throat. Okay, so what do we have here, Mark? All right. Well, we're still not getting a lot of votes, but yes, we have 60% is incorrect. The answer is, get ready, 0%. 99% of us can eat all the cholesterol we want. There is a small percent, one half of 1% of people have what's known as familial hypercholesterolemia, where they basically just, look at an egg and their cholesterol goes up. The rest of us can eat all the dietary cholesterol we want. You might say, why did we all get this wrong? Well, years and years ago, the sugar industry bribed a bunch of researchers to demonize dietary cholesterol and fat because they were in the sugar industry, and it takes a long time to get over that. What big food does, which is somebody said, "Isn't this false advertising?" This is also allowed. It should not be. What big food does is they will claim that foods are cholesterol free, contains no cholesterol, or something like that. Number one, these products probably wouldn't have had cholesterol to begin with. And number two, anytime somebody says something's cholesterol free, it almost invariably, particularly if the label is very bright colors, it almost invariably means it's full of sugar, which it is. And this is they're poisoning you, they're poisoning your kids. So remember before we said that hacks should be easy. And so here's what this cholesterol information, this green light means your employees can eat. They can eat all the eggs they want. And not only are the eggs healthy, but they're probably replacing some cereal like, Kellogg's healthy, these healthy cereals that have some fiber in them, but they're sweetened with sugar. So they're probably replacing that. So that's great. They can eat all the shrimp they want. Shrimp is an excellent source of protein, as are eggs. And of course, to the extent you can afford it, that you can eat all the lobster you want. Because remember before we said that in the best hacks, changing behavior is a feature, not a bug. Now, so in food hacks, it's generally pretty easy to make these things features rather than bugs. You'd be amazed at what you can eat if you're willing to, like me, with my wait, did I miss a bunch of slides in here? No, 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 I didn't miss a bunch of slides. Like me with my hacks, can get very good blood values and still enjoy life. Predatory medicine requires a little bit more initiative on the part of the employee. Um, Predatory medicine means that you're prioritizing profit, not patients, and it's a clash. You cannot do both. You can't be half a gangster, as they said on Boardwalk Empire. And we're not saying, by the way, that PCPs by and large are predatory, not in the least. Employees do need PCPs, hopefully PCPs and independent practices. We do address elsewhere the need to establish a relationship with a PCP so that they have all your information on file in case you need it. And not only that, but we give users what we call a doctor visit prep kit to make that first visit the most helpful. These prep kits, as we'll show later, cover a ton of visits, a ton of different visits, but especially to get people sort of into the system who might not have been. This webinar is not about that. This webinar is about what happens when the worried well meet corporate practice ownership.
And it's also just it's possible to even say that a little stronger, Al. I think where like many doctors are very frustrated by this, but they're in a tough spot because their practice may be owned by some other entity, and there's a revenue target, and maybe that revenue target asks to increase CAT scans by 10% or whatever it may be, right? So like yeah, you could fight that, but if you want to stay employed, you're in a tough spot.
Yes, I mean PCPs are burning out at a horrendous rate, and one reason is that this clash. They want to do, they can make a lot more money in a different specialty, but they want to do what's right for the patients. But often their overseers want them to do what's right for the shareholders. Very well put. The best example of predatory medicine is right in dental. Now, the number one clinical procedure in the country by probably a factor of 5 is filling cavities. There are 120 million cavities filled every year. It turns out that 80 million of them don't need to be. The dentist can paint a solution called silver diamine fluoride right on the decay, and it will arrest the cavity and basically remineralize the tooth. SDF is the only FDA-endorsed breakthrough therapy in all of dentistry. So it is the number one thing in dentistry, but your dentist is not telling you about it. And you'll see why in a second. It's been all over the lay media. The way it works is you take a drop of this stuff, you put on something called or the dentist puts on something called a micro brush, and you brush it right onto the decay, and the decay kind of gets suffocated and arrested, and they don't have to drill out a big hole to put a filling in. But here's the hack. You have to ask for it because it's so unprofitable. The dentist will generally give it to you if you ask for it. And mine actually was quite impressed that I asked for it, but I had to ask. And the reason is that instead of making a couple $100 on a cavity, they make $39. And in Massachusetts might be a little bit less elsewhere. Now, in the case of mine, my wife's employer's health plan is, like many universities, rather antediluvian. Does not cover this particular code, D1354. So I ended up paying the whole thing, but it's still much less expensive than paying half of the cavity. Now, employees, we talked about hacks that employees love. Employees love this hack. We have many video testimonials on it. We're actually going to send you a video testimonial, and this one will have a kid right in it. And as you can see, he's quite happy about, in this case, I believe it was a root canal that they avoided with SDF. And we call this kid our Mikey. We are the only vendor, I might add, that has a Mikey. In fact, that brings us to the next polling question, and I'm seeing a few more Q&As in here. So, what is your view on teaching employees hacks for their children? And normally you don't think about children because you don't realize it's possible to improve them. And while you're doing that, let's make a dent in the accumulated questions, Mark.
There's a comment about doctors. Is there a need to form unions to combat corporate medicine?
That's an excellent question. It's an excellent question. I would say that it is beyond my ken. I do come from a union family for many generations, so my inclination is to be pro-union, but I just don't know the facts well enough.
And do you recommend Quizify instead of wellness or in addition to a wellness program?
Well, it depends on your budget. If you have a small budget and you want to make a big impact, then you would go with Quizify. If you already have a wellness program and it's popular and you don't mind paying a big incentive and you don't mind adding just a little bit to the cost to make the program much more effective, you can do that. And we partner with a couple of wellness vendors and we can partner with anybody else. All right, so I hope everybody says C on this. Yes, okay. C isn't this. This is an opinion, but that is the correct answer. That you want to do both. Definitely both. I'm glad somebody didn't say neither. Now we have another question that I'm going to skip over just because we've got quite a bit to cover, and we try to keep these to 45 minutes. But we talked before about the scans being a perfect example of predatory medicine. And one of the questions that we ask, and you might ask, why am I asking this now instead of before? There's a reason for that, is how much does radiation in a CAT scan compare to the radiation in an X-ray? Well, the answer is it's 100 to 1,000 times more. Then, of course, they're not telling you that. They're not telling you that. And the United States does 20% more than the next highest country and twice as many as the average developed country does. And I might add, most of the countries, if not all of them, have better health outcomes than the United States. The Journal of the American Medical Association slams up what they call our addiction to unnecessary MRIs and CAT scans. And that brings us, um, so to segue to more predatory medicine before I get back to the scans, predatory medicine is actually increasing now. And the reason is that many practices, the large majority actually now in many states, are owned by hospitals, private equity, and big insurers, mostly Optum. I mean, the old days, 10 years ago, they tended to be independent. Your doctor was your doctor, and yeah, they had to deal with insurance, but not so much anymore. They're buying up these clinics and practices en masse. And as Peter mentioned earlier, creating aggressive revenue goals for doctors that leads to overtreatment in order to reach those goals. And this is getting worse as corporate ownership prioritizes profits over patients. Now, you may say, well, we're being paranoid or we're clickbait or whatever, but this is what McKinsey has to say. They just put this out fairly recently, and its corporate ownership is driving McKinsey's high growth forecast for office physicians. Now, let me just set this up for you here. This is the entire healthcare industry. This is the insurers, the providers, the admin services, distributors, and then the producers of products and drugs and biotech. Focus on the providers, and you'll see that the only one, or the one which is expected to have the highest growth, is in fact office-based physicians for the very specific reason that they have to hit these revenue goals. So let's come to another story of my own here. As I mentioned, um, I eat well. I don't eat great. I eat decently, but I use these Quizzify hacks. And as a result of these hacks, my numbers are excellent. This is just from a couple of months ago. Every one of these numbers is excellent. And the way I got to it, they've never been bad. And by the way, I'm not here to brag, although I have to say that is a nice side benefit. But I've done several of the Quizzify hacks. I've been eating a lot more fiber, which turns out to be essentially superfood. When I eat sugar, I eat it either for dessert after lunch, which is what Quizzify recommends, or right before I exercise. So I haven't cut back on my sugar. I just eat it at different times. I have cut back on my hidden sugars now, I have to say. And while I'll tell you the other thing I've done is I've completely ignored the advice from my wife's employee wellness program, which she gets sent. And this is from their health risk assessment, and it recommends low fat or fat-free milk and cheese, low fat or non-fat yogurt. Well, number one, dairy fat is quite good for most people, and I switched to all full fat dairy. But number two, what do they think, the people who did this HRA, what do they think makes non-fat yogurt taste good, right? So in any event, those are my numbers. And because these PCs are, highly stressed, overworked, I said, don't waste your time on me. Don't waste your time on me. No need to interpret this blood work. So that should be the end of it, right? Well, not so fast, Lewis. Um, I got an interpretation. The interpretation was that it looks good at first glance. Yeah, I'll say it looks good at first glance, but somehow I qualify for a statin, even though there's zero negative, no evidence whatsoever that people with good numbers should be on a statin. But more importantly, and to get back to the CT scan point, it was recommended that I do a CT scan of my heart. And by the way, this is a legit procedure for people who are at high risk, not for people who have no risk at all. In fact, Quizify actually recommends it for people at high risk, but not for me. So I would note I would note that Optum owns this practice, okay? But United Healthcare does not provide the insurance. Now, if United Healthcare provided insurance, doing the scan would cost them money. But if Optum owns the practice and is not United Healthcare is not insuring them, it makes them money, right? So so this is why they basically, this is part of these big revenue targets. If United Healthcare were also insuring me, and they would send this to utilization review, and utilization review would come back and say, new scan for you. Okay, of course, and they would be right, by the way. But United Health is not the insurer. So I try to parry this thing, right? I say, instead of a CAT scan, can I get a lipoprotein A test? Now, you might say, what's lipoprotein A? Well, it's considered a very predictive marker for cardiac disease. And the beauty of it is, as a test, is that it is completely independent, and I might add causal, independent and causal. So you could have good numbers here, but if your lipoprotein A is over, say, 75, you are at higher risk and something should be done. Now, you haven't heard of lipoprotein A, but it is a go-to lesson that Quizify gives, because guess who has heard of it and is all over it, which is the very same Marty Makary and Harvard Medical School. So your wellness vendor is probably quite a bit behind the times on this, but this is an important test for people who are at high risk. Frankly, even for people who are at low risk, can benefit from it. So what is my lipoprotein A? It is supposed to be under 75 and it is under 10. So this should be the end of it, right? I've aced all the tests. Nope. Your lipoprotein A was nice and low. Good news. Further supporting your low cardiac risk. As I mentioned, the calcium score CT scan is another way to further hone in. How much honing do I need here, right? So I passed on it altogether, and that should be the end of it, right? Because I mean, it's not like I need to go to a cardiologist or anything, right? Wrong. Um, I was offered a referral to see a cardiologist. Okay, you wonder why you can't get in to see a medical specialist as opposed to doing a surgical procedure. That's the reason, because there's not enough of them, and there's too much revenue generation going on. Let me give you another example. Once again, these are all me, but I am not alone. Okay, what you saw from McKinsey is that this is happening everywhere. This is my very own bladder. So I was exposed to a bladder carcinogen literally 40 odd years ago. Some slipped into my vegetable garden. So I did get bladder tumors, which are all environmental. And through 2015, I had 5 removed, and I had some chemo so they wouldn't come back. Um, And then they do this thing called a cystoscopy that sounds like what it is, and it's uncomfortable just thinking about it. And they were perfectly clean. And ever since then, I learned then that in fact you could pee into a cup, and there was a simple test that would tell you whether you need a cystoscopy. My samples have always been clean, so I haven't seen a urologist since my old one left the practice. But then Optum wanted me referred to a new urologist who ordered another cystoscopy. Because mind you, these cystoscopies are very profitable. If you look down here, it says that someone is offering a flat rate cash price of $5,232 for this procedure that I might add takes 5 to 10 minutes in the office under not even under anesthesia. This is ideal for patients who don't have or don't want to use insurance. Okay, I think they got to go to the thesaurus and learn the definition of ideal here. And by the way, my practice wasn't paying anything like this, but even so, paying $500 for a 5 to 10 minute procedure seems a little out of line. So I declined the cystoscopy and just asked to do a different P test. So I did it, and there were no cancer cells. So this should be the end of it. No, the guy says, well, just in case, let's do it. Oh, just to be safe. When you hear the words just to be safe, it means the test is unnecessary. Let's do another test, a different test. So we did a different test. And once again, negative. So this should be the end of it, right? Nope. One more test. This one is a very high-tech test, probably cost $500 itself. Negative. So this should all be the end of it, right? I mean, I've aced every test, but as we've learned, when Optum owns a practice, when you get negative tests, it's time for another CAT scan, in this case, another cystoscopy recommendation. So this time I had enough sense to decline, as you can see, the CAT scan, but they're still being quite adamant about the cystoscopy. Do I want to schedule it? No, 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 and no. The thing is, when you don't have any indication for a test and you're fishing for disease, you're going to find stuff eventually, and most of the stuff you find is what's known as incidentalomas, things that would not harm you, but will stress you out. And the test itself can be hazardous, like the CAT scan with the radiation. And then, by the way, this CAT scan would have been radiation over my entire abdomen, would have been more likely to cause a cancer than to detect one, a legit one. And the scans and the tests themselves can, I got a bladder infection from a cystoscopy once. So, we have a saying in Quizzify, just because it's healthcare doesn't mean it's good for you. And that's something we try to drive home with people who are saying, I want nothing but the best. I want more tests. We want them to take a more measured view of what you should be doing as a patient, what you should learn, what you should be able to talk to your doctor about. So just to wrap this one up, I got a little bit, to use a urology pun, I got a little pissed at my urologist here. And I'm not recommending that employees do this, but I said this is an absurd amount of overtesting after 3 clean cytologies in a row, including a high-tech genetic test. I'm switching back to my old urologist, and I've asked blank to send the records to her. And then I added, because I asked, there's 2 questions you should ask before it's a CAT scan. One is, isn't there a lot of radiation in that? And the second is, how will this change the treatment plan? And the answer in my case is it wouldn't have changed the treatment plan at all. And when I asked about the radiation, the doctor said, quote unquote, it's like an X-ray. So I gave a little PS. It's not like an X-ray, okay? Urologists are one of the specialties that is particularly predatory because they make so much money on their most common procedure, which is a transurethral resection of the prostate. You're not going to see a lot of male sex organs in webinars in wellness, but this is an exception. They go in, and they call it a rotor-rooter. Actually, it looks like one. You can imagine how painful this must be, but it's also very profitable. And yet, for several years now, essentially a better result actually is achieved with a new technology where you essentially apply water vapor, hot water vapor, to your prostate using something that does not look at all like a rotor-rooter, and you're back on your feet in ordinary course of business in 1 or 2 days. 80% of prostates are done this way, 20% are done that way. The reimbursement here, I think, is 4.5 times as high as the reimbursement here.
Yeah.
And the
And it's
best,
also it's also kind of important that, like, on the one hand there's a financial motive, but then there's also just inertia too, right? Because it just takes a long time for a better or new practice to get adopted fully. Sometimes it takes decades.
yeah, actually, the very same Marty Makary wrote that up a few years ago. 17 years is how long it takes for a better, something that's known to be better to become fairly universally used. And the best example of predatory medicine is the colonoscopy, probably. 15 million screens. This does not include diagnostic ones where you had a reason to get it. 15 million colonoscopy screens were performed in 2023. Most did not need to be. Now, colon screening, by the way, screening for colon cancer is the most important thing to screen for if you look at the outcomes of people who are screened versus people who aren't. So we absolutely want you to screen. But it turns out that if you do Cologuard every 3 years, just like the ads on TV say, if you do Cologuard every 3 years, you get as much predictive value and the same actually the same death rate as you get from doing a colonoscopy every 10 years. And these things are very simple, just like it says on the TV. You simply, to use a technical clinical word, you poop into this, you add the fluid, and then you immediately put the top back on. The directions, by the way, don't specify immediately, but trust me when I tell you that immediately cannot come soon enough. And you mail it back to them. Occasionally, they will have a inconclusive, in which case you do have to get a colonoscopy covered, 100% covered, but most of the time that's the end of it. Um, so the thing about these hacks is that it's having the knowledge and the confidence, and Quizzify gives you both, to ask a few questions. And we have some sample questions here that you can ask. And in fact, we actually have what we call a doctor visit prep kit. It's a cheat sheet to bring these questions with you for 200 different topics, 1,250 different questions, 200 different topics, right into the clinical appointment, download it into your phone, download it into your calendar so you're supported even when you're in the doctor's office. So um, let's do one final polling question. I think we'll have a few more Q&A at the end, but why wouldn't you try to help employees overcome their knowledge deficit? You don't want to interfere with the doctor-patient relationship. We don't trust either Harvard Medical School or the FDA commissioner. We have other priorities, or we hadn't known that these hacks and many others were possible. Now that we do, we will. And Mark, can we make a dent in the Q&A here?
Yeah, there's a question about, is there a way to find out the level of hospital or PE ownership or an insurer ownership of a physician practice? I mean, I can answer in my case, the name of the practice changes to the name of the hospital system in the tri-state area. So you see that. That's one way that, Al, do you have any further comment?
I think that's an excellent one. I mean, mine now says Optimum. They've gone from being a very responsible bunch to people that I have to just, caveat emptor. Um, and yeah, what do we have for this one?
Okay, here we go.
Or do we have another question? Okay,
Well,
yes. Okay, this is the correct answer, folks. Thank you. Um, As for those of you who don't want to interfere with a doctor-patient relationship, you have to remember it is now a doctor-patient private equity relationship or a doctor-patient Optum relationship. And it does need, I'm not going to call it interference, but you do need to, just like when you go in to buy a car, you've read Consumer Reports and you know what the dealer is paying for the car. This is no different. You're just giving your employees some support.
Yeah,
But,
I've actually shown our material to a lot of my doctor friends, and they all universally appreciate it because that it also helps them if patients know more things, and then makes the conversation more intelligent.
right. And then we have this thing here that will actually guide you through the visit. So you don't have to be adversarial. Now, I was a little adversarial with that urologist, justifiably so, I might add. So the way we teach this is we have these hacks, um, and literally we have 1,800 questions, and they're all about different topics. We've got this great quiz now on microplastics, and it will disgust you. I mean, it will engage you and your employees, but it's really gross. We have
And
the
speaking
Harvard.
of immediate behavior change, it'll most likely, hopefully, you will not use a plastic water bottle again.
Yes, you will start getting unless you live in, say, Flint, Michigan or something, you'll start getting your water from the tap, um, which turns out I'm giving away one of the questions to have about 0.1% as much microplastic in it as the bottled water. This stuff comes to you on a phone or on a PC. It's bite-sized, it's memorable. We do 10 questions a month, typically with some bonus quizzes. Um, we get a lot of behavior change. You don't even need an incentive. I mean, it's nice to have a drawing or something, but we've seen these wellness programs where you have to pay people, a few $100 a year to get them to participate. No, we would never recommend that for Quizify. People have to participate because they want to participate. And yeah, there's a drawing, but most of the time you're going to get people. We put up these bonus quizzes and people will play them even though there's no drawing or incentive involved at all. 95% report learning something new, and we don't charge for the other 5%. And as you saw today, everybody here, I bet, is going to change at least one behavior next time you go to the doctor or next time you go to the store. We have not shown you our custom questions. We would do that individually for you. So, Peter, I'm going to turn it over to you to talk about just how you make this all happen.
Sure. So hopefully the benefit is obvious, and I think we can all pretty easily agree that if everybody were much more knowledgeable, they'd both make better decisions, have better lives, and save money. So we thought pretty deeply about what would prevent someone from wanting to do this, and we tend to just think of it as two simple things. There's cost in terms of hassle, and there's cost in terms of money. And maybe the hassle component is actually the bigger concern. So we have pretty painstakingly shaved every step out of this process to make it as minimal as possible. And that's why we call it the default 5-minute implementation, where that is literally true. This could be started in 5 minutes if you just go with the defaults. So, that involves, we don't collect any PHI. It's just a mailing list, some kind of distribution list. We have actually a variety of ways to distribute on top of email, including intranet and posters. But all you're doing is you're sending links around to people. So there's very little pain in getting this out to everyone. And then in terms of sort of ongoing management, we actually have now our own rewards program internally that just kind of runs in a closed loop. So you don't even have to do anything about that. People play. Some percentage win gift cards, and we actually have this nifty new thing where there's a wide range of gift cards they can select from, and they do that all themselves. Gift cards are sent to them. It's all set, and then reporting is the same. You could just passively consume the reports the way you would, account statements from your bank. And so in theory, you don't have to do anything. If you want to do something, that's your right, but that is up to you. Now, in terms of the money portion of the cost, we have, as most vendors, conventional pricing of $12 per employee per year. And I suppose that's a good option if you want just sort of budget certainty. But we also, if you're at all concerned about, usage, and although we know that you'll find our usage is higher and sometimes dramatically higher than all the other wellness programs you have, if you're still concerned about it, you can just pick the engagement pricing, which we also kind of call if they don't play, you don't pay. So it would just be per quiz. And if you're wondering how these two numbers compare with each other, if about 25% of your employee population, which is kind of roughly our global average, if they all participate within a year, these costs would be exactly the same. So that's how it's kind of zeroed out. So if you're concerned you're going to be below 25%, go ahead and go with the engagement pricing, and you'll only pay for what people actually use. It's worth noting there are a few other goodies in there. Like we actually do a survey after the quizzes. Did you learn something new? And we actually further discount. So that $6 is per quiz minus the percent of people that say they don't learn something new. So it's actually even further discounted for usage and benefit.
We say if they don't play, you don't pay, and if they don't learn, we don't earn. So you are only paying for people who play, and learn.
Yeah,
Um,
and that automated reward mentioned actually comes out of our part of out of our revenue. So it's not like an upcharge. Whatever you're paying one of these two options, the rewards come out of that. So, all right, if we keep going, please. And to make it even easier, since again, like we very strongly, I mean, almost religiously at this point, believe that if this gets in the hands of people, they will learn and they will enjoy it. We have so much evidence of this across so many different kinds of companies. I once had a guy call me from literally a tugboat in the Mississippi River, like it was Mark Twain, about he had some question about like the rewards or something from logging in. So like we've worked with all sorts of companies. There has not been an instance where a significant number of people didn't learn and enjoy things. It varies by company, varies by how the distribution is done, and so on. But like generally, the benefit is there. So we're just trying to make this as much of a no-brainer as possible, and that's why we came up with the $500 pilot, where it's very simple. You get $500. You get 2 months. We made like a special curriculum that's sort of crammed into 2 months, and you get a bunch of it up front. Then you get another lesson every week, and you can invite as many people as you want. If you want to invite 1,000 people, that's up to you. It's not no skin off our back. And we actually even guarantee further that in that survey we have, which is just a standard one-question survey at the end of every quiz, 90% of people will overall say they learned something new.
yeah, and one reason we do this is that our retention rate is very high. It is difficult for us to sell new clients because the big consulting firms generally don't like us. We don't pay them under the table or anything. And we don't fit into a category. And people are always saying, well, what category should we look at? Well, we find we get people under the tent, they stay under the tent.
Yeah.
So
So the summary of all that could be actually like if what we just said isn't easy enough for you to try it, you tell us how to make it easier and we'll make that happen, because all we want you to do is have your employees try it, and because we know they'll like it.
all right. Well, it is now 1:43, and we do promise to stop on time, and there are a bunch of
Yeah, let
questions.
me just mention one thing. An anonymous attendee asked us if we had any examples of employees who have woven in health literacy into their wellness programs. Yes, we have plenty of examples. I mean, we can be a simple option. We can be a complete wellness program. And if you wanted to email Mark down at the bottom of the screen, Mark, M-A-R-K, at Quizzify.com, I'd be happy to send you some examples. When we work with a client, that's part of how we bring them on board. We talk about their incentive program, how we get woven in terms we can manage rewards, we can pay out rewards, we can track results, track the engagement activity, and you're only paying for people that actually do participate and do also say they learn. So that's one of the questions there.
Do
The
one more, and then we'll close
Now,
it
if
up.
you want the recording, you've got to actually email us as well. We'd be happy to send it to you, but just ping me at the same email address. And the another question here is that I don't see the Validation Institute logo. Are you validated?
Oh, yes, absolutely. But we're validated at the highest level, or second highest level, by the Validation Institute. And the only reason it's not on is because when you've got the FDA commissioner and you've got Harvard Medical School, nothing personal against the Validation Institute, but those are the two headliners. So on that note, let's close it out as promised, 45 minutes. And we will send everybody the link to we said we send you a link to a testimonial. And I think since we're in a good mood, we'll send you a link to our microplastics quiz as well. Signing off. Thank you very much, everybody.
Thank you.